1991. He has completed his diploma in systems management from NIT in the year 1992 and his post-graduation diploma in marketing management in the year 1997 from Indira Gandhi Open University. He has functioned in healthcare industry since 20 years. He has served in various positions as senior manager, system delivery and business management, channel management and value segment business. He is responsible for customer, people and business management of Philips Healthcare customer services in India, Bangladesh, Sri Lanka, Nepal and Bhutan for all medical products. He is the business head of customer service which focuses on P&L of service business, NPS and customer satisfaction. He was a senior engineer at Philips Medical Systems from 1992 to 1997 in Bangalore. He was National Specialist in Cardiovascular System Philips Chennai from 1997 to 2000. Mr. Shankar was Customer Care Regional Manager from 2001 to 2007 Mumbai. He then became Regional Manager for South and West Regional Zone from 2007 to 2009 Chennai. He was the General Manager from January to December 2010 Gurgaon. Mr. Shankar is currently the Director of Customer Service in Philips Electronics India Limited since March 2012 Chennai. He is a cardiac and vascular systems specialist and a certified Six Sigma Green Belt. He is well versed in distributor management in customer service. He is known to have established service delivery and business models for Philips acquired companies in the areas of cath labs and X-ray business segments. He has established service business model for respironics ventilators. His specialties include building teams for service delivery and creating new business models for acquired companies, particularly in value segmentation. Once again, on behalf of Biomedical Engineering Department, I welcome you, sir. Thank you very much.
As our chief guest, Mr. S. Shankar, Director Customer Service, Philips Healthcare India Limited, to address the crowd, share his ideas, experiences and challenges faced in the industry with a presentation on future trends in healthcare.
Good morning to all of you. First and foremost, I'm extremely honored to be here amongst this august audience. Respected Dr. Biomedical, Angurajan, friends from industry, students of SRM College, plus the other biomedical friends who have come from across India and various hospitals. Warm welcome to all of you and greetings to all of you. Before I get into the future of medical technology, just want to address a few important points. I must thank SRM Medical, SRM University, Biomedical Engineering College faculty department here for providing this kind of an opportunity for students like here to benefit out of the industry plus curriculum joint venture that will help you to enrich your knowledge. SRM is probably one of the few institutes across India who also have a privilege of having a medical college attached to them, which means the students of biomedical engineering course studying in SRM have a very distinct advantage compared to friends outside, that you can connect with your hospital faculty, take the benefit of the modern technology that is emerging out of the imaging market plus the medical devices market. Not many colleges have this kind of unique opportunity to learn while also you get practical knowledge from what your own sister institute has got. So it's very important for the students of SRM here to utilize such kind of opportunity available with your esteemed institute. As far as Philips is concerned, we've been now associated with SRM for the last 1 year, starting from the previous similar such conference that emanated. I'm happy to share that with a lot of interest being shown from SRM, Philips is equally been able to partner with the SRM Institute in terms of offering internship to students. So already in the last 6 months, Philips has entertained 4 interns from the SRM Engineering College, students from Biomedical, who probably would have, I presume, benefited by being partnering along with us. The second good thing which this partnership is also bringing us, while we are scouting talent year on year to meet our manpower needs, we have also chosen SRM as one of the premier institutes where we will go for campus interview. And I'm happy to share, next week we are here in this institute to recruit about 2 to 4 students, specifically in the field of biomedical engineering. So this is only a beginning from where we would want to take this joint cooperation to a larger, much larger scale. This is just conceived about 6 months back, where I must really bring it to this audience to say Dr. Amburajan is taking extremely keen interest in following up with us, being proactive in making things happen for your institute. We are also additionally assuring in front of all of you, plus to your faculty, there are 2-3 hospitals of SRM in Chennai where Philips has got a very active presence in terms of hospital medical imaging equipment. Now, the specialists from Philips are willing to help the students of biomedical engineering in SRM be available on specific days at prior notice to ensure that we are able to run you through the benefits of having those equipments, what these equipments are functioning for, so that it helps in your curriculum to learn and also see it in the practical experience. That's something which the students of SRM are privileged for and must utilize it. Having said this, what I understood from this Bioyantra', the purpose of this conference very clearly is for an industry institutional collaboration and how the technological advances are taking place. Now, I'm going to cover a short presentation on the future of technology, which probably will students of SRM plus the other members who are present here will find it useful. What we foresee as the technological advancements that are going to happen in the next 5 to 6 years. Plus, I will also touch base a few minutes on what are the career opportunities for people from biomedical engineering who can, with the industry, participate and develop their career for. I don't know how relevant it is to bring this to this knowledge. There's an often saying, hurry, curry and worry. These 3 are the bane of the people today. Dr. Muthamil Chelvan was candid in sharing a lot of good information as to how we've been addicted with iPhones, iPads, iPods, etc. Yes, added to this fast-paced world, what we have brought to ourselves is hurry, worry and curry. And all these 3 are only bringing in lifestyle diseases to most of us. All of us are aware of this. What this means, more and more people are getting to know what kind of diseases are afflicting them. The medical advancements are becoming such that more and more diseases are coming to light, more and more diagnoses are available for diseases which were hitherto unknown, and equally the pharma companies are coming out with medicines and curative medicines for this, which means increase in diseases, increase in treatment, people are becoming more aware, hence hospitals are bound to improve and increase in volume. So what's being very clearly told of is in the next 5 years, 6,000 hospitals, new hospitals are going to come up, and that's what the industry predicts today. And what this means is a huge amount of opportunity for people associated with healthcare in terms of service delivery, in terms of medical devices, in terms of R&D, in terms of doctors who are treating. All these professions are going to grow manifold. That in turn translates into so much of job opportunities for people who are in this field. It's one of the fastest growing fields today, and I do not foresee that this is going to slow down whether in terms of economic position, because food, clothing and medical are three industries which are going to survive whatever crisis which will happen, because those are the needs, the basic needs of human beings. And hence, people here should thank themselves to have been choosing this biomedical field for wonderful opportunities that exist for them. Having said this, let me run through now what the future of healthcare is going to be for the next 5 years. We are going to see most of the hospitals in future running paperless. Data analytics and personalized medicine. So, when I'm going to talk of these technologies, I would want the students here to able to connect with these various topics to see future what is their interest in these kind of topics and how possibly this can help translate into a job opportunity for you. Big data and personalized medicine. Data analytics is going to become future of the day. As we see immense amount of data available in field today, how is that this data can be collated and brought to useful progress for the mankind is going to significantly play for future. You see, telehealth. We do not have today a lot of medical professionals, doctors, nurses available to treat all of us, and hence specialists are going to make sure that their services are available to the industry by telehealth. Image guided therapy. We have moved away far from starting with X-rays, which are used for diagnosing bone fractures, etc. Today to therapy, where this is not only diagnostic, you get into curative, and how the image guided equipments can help actually cure diseases or perform surgeries. So image guided therapy is going to lead the front. Hybrid imaging and quantification. There are people who are aware of what kind of technologies are today available. You will slowly start seeing that these technologies are actually converging. Whether it was cath lab which was earlier, today you see a cath lab with an OT with a hybrid cath labs which are coming up. So you're talking of an MR which was a standalone modality some time back. Today you're seeing it's getting fused with PET modality. If you talk of CT, that's getting fused with the PET modality. Now, not only is physical orientation and diseases are being diagnosed, what is also being diagnosed is the functional imaging parts of the body, and hence you will see that this fusion is becoming more and more relevant in today's industry. As we move on, the perils of radiation are being felt by many, and hence you will slowly start seeing that world is moving towards lesser and lesser dose and radiation free in the healthcare industry. And most important, from hospitals, the healthcare services will slowly start moving towards homes, and you will see why I'm talking of this. So these 7 technologies, as I foresee from the industry, is going to take place in the next 5 to 10 years, which will play a significant role in job opportunity creation for all the students who are in this biomedical field. When you talk of paperless hospital, when you move on, as you will see, this is what is today's situation in many of the hospitals. So there are super specialty hospitals today which are very hi-fi, connected wirelessly across hospitals. PACS and hospital information systems, etc. are prevalent in few hospitals, but 80% or 90% of the hospitals today in India, you still see this is the current scenario. Now, when you actually want to retrieve a record for a patient who goes to a hospital, you will slowly start seeing that it's becoming humongous task for the hospitals to retrieve data, and hence the future of technology is going to move towards paperless. And when I say that, this is a chart which is normally seen in an intensive care unit. So for people who have been to hospitals, if you see in intensive care units, there will be a lot of nurses who will go rounds every day morning and taking on charting. So they will note down for each patient in each bed how much amount of, what's the temperature, what's the kind of sugar levels, what's the various blood counts, heartbeat, plus what kind of medicines are being administered. Now this is a very laborious task which is being followed in most of the hospitals today. What is going to become in future is this kind of charting which is going to get completely digitized, and the use of intelligent gadgets will come into play which will help in this completely getting paperless. Now this is one of the solutions which are currently available in the market, which is called the IntelliSpace critical care anesthesia. I don't know how many people are able to connect with this. what this clearly is this is an electronic revolution which will come up in all the hospitals, turning them into having all the data digitally stored, retrieved from a centralized server as and when it is required, for nurses at the bedside, so that every day morning when they go for rounds, all that they need to carry is a simple iPad, go to the patient, connect it. A doctor who is miles away, he may not be available in the hospital, miles away, can actually, through his smartphone, as Professor said, or his iPhone, able to see the data in his mobile phone and be able to advise to the patients what kind of cure is going to come. Now, what this means, these are all applications in electronics which are actually converting this. That calls for people in this group here who can collaborate with those industries to develop them into your job opportunities. As we move on to the next slide. Yeah. So big data and personalized machine. So people familiar with the various imaging equipments as you study in your post curriculum. There are plenty of imaging equipments today. Whether it's MR, CT, a cardiovascular system, or a ventilator in a hospital ICU, anesthesia equipment, ambulatory defibrillator, the basic ECG machines, the PET scanner. Lots of data are being produced by all these devices about patients. Now, when a doctor goes, today what majority of them is seeing is going through films, going through paper sheets, printouts being used with patients carry bag. Now you will see after 1 year your ultrasound image gets completely washed away because it's all done on a thermal paper. Hardly is these data which are used in past being available for future use. So the kind of data which is being generated out of this, how it today is getting converted is, these are all getting pulled into one, and there are experts who are analytical. With analytical frame of mind, people with biomedical orientation can get into studying data analytics. This is a big growing field today. A lot of research is happening. People can go and study the patterns of disease, the patterns of kind of medication being offered, and how things can really help in improving the lives. In addition, brings in a lot of useful information which will result to better patient care. So as you would rightly see here, patient-specific information can be intelligently filtered, comprehensively presented to the doctors as and when required at the right time. Telehealth. So as I clearly said, in every hospital in critical care, if you see today, after post-surgery, for 72 hours, the patient is kept and monitored in an ICU, which is the most crucial time for every patient after surgery is done. Now, not every hospital has got specialized doctors to monitor these people continuously. Then, what is very important here is, please go back. Go back. Yeah. So, lot of errors which happen today. It is being published officially that medical errors are the 6th leading cause of mortality. And why this is happening is simply because of lack of insufficient specialists or doctors who are available to monitor 24 hours and give the right kind of medicine prescribed, etc. So as you will see, there is a big shortage of critical care physicians and qualified operation theatre ICU nurses. Now, as I said, 6,000 hospitals are going to come up in the next 5 years. That's going to translate into close to about 100,000 ICU beds. If you're going to talk of 100,000 ICU beds, so much of exploration of growth is going to happen. For doing this much of expansion